Hey guys, welcome back to Clinical Physio. I'm Khalid Maidan, and in today's video I'm going to be taking you through my top tips for patellar tendinopathies. Now this is notoriously a really challenging condition and it certainly has lots of complexities to it. So with this video I'm going to try and help you improve your ability to manage your patients when they walk in with a patellar tendinopathy. So let's get into it. Let's get clinical. So the first tip is all about load management. It goes without saying that whenever our patient has a tendinopathy, it indicates that that tendon has been overloaded, meaning that there has been too much demand placed on that tendon, which it's been unable to cope with. So as a result, we need to have a chat with our patient to see if we can work out where that overloading has taken place. Has it been that your patient has just started running? Have they been running for a long time, but suddenly increased the amount of running they're doing, perhaps because of an event such as a half marathon? Have they just got started in an exercise class which involves a lot of stepping? Or have they moved house last weekend where they were going up and down the stairs for 8 hours a day? Whatever it may be, it's important for us to try and identify the factor that increased the loading and then modify it. If it has been to do with a sudden increase in running, reduce it. If your patient has attended an exercise class with lots of stepping, see if they're able to attend a class with less stepping that might be easier for them. But whatever it is, try and make sure that your patient doesn't stop everything, because that means that their tendon has no loading at all, which means that it may well get a lot weaker and might make it a lot more challenging to rehabilitate. Next, let's talk about medication. First of all, general pain relief can always be a good thing for musculoskeletal conditions, including patellar tendinopathies. But what about non-steroidal anti-inflammatory drugs? Well, unfortunately, there's very little evidence to suggest that these are beneficial when it comes to patellar tendinopathies. Warden and Bruckner in 2003 and Pearson and Licence in 2005 established that there's not much evidence at all and suggest that it actually isn't used in practice. Warden and Bruckner went on to establish that the next level up, corticosteroid injections, are also definitely not a good thing to do, as they can inhibit collagen synthesis, which can lead to cell death and tendon atrophy. Next up is exercises, and step one for me always includes some isometrics. Evidence such as that of Van Ark et al. In 2016 demonstrates that there's really good evidence to support the use of isometrics when it comes to patellar tendinopathies, mainly because of their ability to improve pain control in the early stages. So how do we do these? Well, if you have access to a gym, simply get yourself on a leg extension machine and place yourself so that you are holding the bar in a certain position without moving. Start in a mid-range position and gradually increase the height of the bar to a fully knee extended position. If you don't have access to a gym, then you can simply use a fastened belt at home, which is looped around a chair leg and then placed just higher than your ankle, and you can simply push that forward to recreate a leg extension. So how long should we be doing these for? Well, Malieris et al. In 2015 found that there's really good evidence to suggest that 5 repetitions of 45 seconds, 2 to 3 times a day, is a great place to start. Gradually increase the intensity of the leg extension, moving up to a maximal voluntary contraction of 70%. Step 2 in my program is to move on to some good old-fashioned isotonic strengthening exercises. I always find that a good place to start is something like a leg press, where your patient can move on to an incline leg press as they get stronger. Now, how about leg extensions? This exercise has been a complicated one over the years, as many people in the past suggested that it puts too much load through the tendon. However, researchers recently, particularly the fantastic Pete Malieris, have demonstrated that this has been a really good exercise to include in patellar tendinopathy rehab. So personally, I'm a fan. Get it in your program, but make sure you're gradually progressing the load and the number of reps to make sure your patient doesn't find it too irritable. Step 3, decide when you're going to reintroduce squats into the patient's program. And that's because these exercises can be naturally quite challenging, and therefore it's important to determine when the right time for them to do that is, which is naturally going to be when they've got stronger from the step 2 exercises and they can start doing these exercises without a huge increase in their pain levels. Now naturally at the beginning, squats can be difficult to do. So ways of making it easier may include doing squats on a decline, where your patient can put their heels on a book so that they are offloading their patellar tendon. Another opportunity you can use is kettlebell swings. Now, of course, kettlebell swings are mainly geared towards hip extension, but as you can see in this video, you can introduce a little bit of knee bend into the movement to allow them to start getting into a movement which is similar to squatting. And from there, they can increase to squats as it gets easier for them. Just make sure you're using the right load and the right number of repetitions as your patient feels comfortable. Step 4 is plyometrics. So once your patient has got really good at their machine and squatting based movements, and they're definitely getting stronger, think about those more explosive movements that you can help them train for. So examples you could use could include squat jumps, box jumps, and double leg hops, to include a few. And of course, once you've done the double leg stuff, think about single leg activity, things like single leg hopping. And my step 5 is a return to sport. Take the time to really think about the movements that your patient has to replicate at their patellar tendon when it comes to their sports. So for footballers, it might be twisting and turning. For volleyball and basketball players, it might be jumping and landing. And if your patient's involved in athletics, they might be doing things like the triple jump or hurdles, which involve a lot of hopping. Whatever your patient's sport is, have a good chat to them about what they do. They know their sport better than anyone else, and therefore it's important that you include them and ask, what activities are you going to need to do? What activities do you need to feel confident doing in order for you to return to sport? Just make sure that once again, you're taking things in a gradual manner and progressing as they feel able to, in line with their strength. So guys, if you've enjoyed this video, please make sure you hit the subscribe button below. Follow us on our best and most interactive social media channel, which is @ClinicalPhysio on Instagram, and check out our website, www.clinicalphysio.com. My name's Khalid Maidan. Thank you so much for joining us, and we will see you very soon, right here on Clinical Physio.